So I'm here with my brother, David LaChapelle, and years ago I can remember that time when you were young and you were having back pain, stuff like that, and then remember you going to the doctor, and can you just share a little bit about that when you were going to the doctor and what they were saying, like?
Well, what happened was, I don't know, probably started when I was about 12 or so. I started having pretty bad pains in my lower back. And there were multiple occasions the school had to call. My mom had to come pick me up, take me to the doctor. And they just couldn't figure out what was going on. So at first they thought that I had a kidney problem or a kidney infection, but they could never really find anything. So they started doing testing. And pretty much the long and the short of it is they just kept saying it's in your head. I can't find anything. It's in your head. It's stress. It's anxiety. And so that's pretty much the way I accepted it. At one point, they did some tests and they found that my kidney was having spasms. But again, they said that was just normal. I mean, that just happens sometimes. So
I thought I remember a time where they were telling mom, like, maybe take him to counseling or something.
yeah, they said, maybe talk to somebody to see if it's my anxiety, if I have some sort of underlying anxiety issue, which I didn't feel like I had. I mean, I never had any
Yeah.
stress or anxiety. Had a pretty simple, easy childhood, so it didn't seem like it. But yeah.
And then what was going on in your mind? Are you starting to think like, God, maybe it is in my head? Or are you like, no, there's something wrong?
No, I thought something was wrong, and I kept saying, and I told my mom, and she believed me, but they couldn't find anything. I mean, I was in the hospital probably 3 different times. I got taken to the hospital because it was so bad, and they had to put me on pain pills and try to figure it out because I was in such bad shape. I was actually 25, and I was in the Navy, and between that period of time, periodically I'd have some pretty bad times. I never really tracked what was causing it, but I'd have it. But because I was told it was in my head and it was all psychosomatic, basically, I learned how to do breathing exercises and relax. And usually after an hour or two, I could actually get the pain to be tolerable and I was okay. But then when I was 25, I was I was in the Navy, and I was actually on their touch football team, and we were at practice, and I happened to land on my side, and it came out where it looked like I'd got the wind knocked out of me. But I was with some doctors who were also on the team because I was at Balboa Naval Hospital, and after about 10 minutes, I was like, guys, something's not right here. It's not. I didn't get the wind knocked out of me. We know something's wrong. So we checked, and sure enough, they could tell I was going into hypothalamic shock. So they rushed me over to the hospital into trauma, and subsequently found out that this whole time my kidney had a narrowing in the urethra or something in that, something like that. And just years and years and years, the kidney had actually expanded to a point where when I fell, it ruptured. And that's kind of where I started bleeding internally and bleeding out. So they had attempted to save it, but they couldn't. So I ended up having my kidney removed.
So what did that do for your mind of, I knew there was something wrong, or what were you thinking?
Yeah, exactly. It's just like, the frustrating part was the doctors told me if they would have caught this correctly when I was younger, it would have been a pretty simple surgery even back then, and I would never had a problem, would not have lost my kidney, it would not have been this traumatic issue, would never have occurred. But because of it, and it was missed, it got worse and worse, obviously, to a point where they could not save my kidney. Simple as that.
So what do you say to doctors? And there's so many misdiagnoses, things not being caught, doctors sometimes not listening to patients and just thinking, like what you just described, like, hey, it's in your head or whatever. What do you say to them in being careful and being maybe more persistent when the patient is really saying, hey, there's something wrong here, as you know your body more than anybody?
Yeah, I think sometimes, and it's hard, I understand it because I'm in the field, but I think what you have to do when a patient is being persistent, or even if they're not necessarily being persistent, because some people just believe, but if you really can't find a diagnosis or you can't find out what's going on, maybe sometimes taking a step back and rethinking the process, maybe rethinking what could or could not be happening, maybe think outside the box. Maybe step away sometimes from some of the testing, because there's a ton of tests out there, and just step back and look and think about it, and maybe consider what's the patient may be going through, put yourself in their shoes. But I think the main thing is just take a step back and make sure you didn't miss anything, because sometimes we depend on tests, I think, too often nowadays because they're simple, and for the most part, they're pretty accurate. But if things aren't matching, it's time to step back and maybe consider an alternative.
All right. Well, thanks for sharing your story.